Look, we've got our next guest speaker, and I'm very pleased to introduce Clem Byard. Sorry, Clem. Clem and I used to work back at Peter MacCallum a year ago, so it's great to be involved with you again. So thank you so much for coming today. Now, Clem is a clinical nurse specialist who works on the 131120, that's the right number, isn't it? Cancer information and support line and cancer prevention, at the Cancer Council in Victoria. Clem has previously worked at Peter MacCallum Cancer Centre and at the Centre of Palliative Care at St Vincent's Hospital in Melbourne. Clem has a background in supportive care research and has worked on projects exploring palliative care, survivorship, tele-health, patient monitoring, encouraging patient self-care and improving nurse-patient communication. And we're very pleased to have Clem here to talk a little bit about some of the work that he does with the Cancer Council, and also a little bit about the emotional impact that cancer has, and has some little tips probably there too. Thanks, Clem.
Thanks, Donna. All right, now hopefully you can see my screen now. If I just share it, there we are.
Yes.
Does that come up all right?
Perfect.
Has that not gone to full screen? There we are. So thanks for that, Donna, and thank you, Deb. That was a real privilege to hear about your long journey. So yes, I'm a nurse at Cancer Council Victoria, and I work on the 131120 Cancer Information and Support Line. And so I guess that's the perspective that I'm bringing today as a nurse. I did work at Peter Mac with Donna previously, and then I've spent 5 years working on 131120. And we get calls from patients and family members, but also just from the general public who are maybe concerned about cancer, and from other health professionals who might not work in the cancer field. And so it's part of our job to know a lot of the supports that are out there and to help, guide people to the sort of supports they need. And I was just really struck while listening to Deb, anything that I know about the emotional side of cancer, I know secondhand from having listened to people who are going through it or whose loved ones are going through it. And it's such it's a privilege. It's so important for we as healthcare professionals to listen to the experiences of people, because it is such an individual thing. You can have two, women the same age, the same diagnosis, the same background, and yet their journeys, or however you'd like to characterise that, can be incredibly different. And you won't find that out unless you listen carefully. I suppose I've been privileged to have quite a lot of communication skills training through my career, and I now sort of teach and facilitate training for that. But a lot of health professionals in our system don't have, or have very limited access to that. So that's something to bear in mind, I guess. All right. So being diagnosed with cancer can be an enormously, upsetting thing for people. It goes without saying. There are certain times throughout a diagnosis that can be particularly challenging, and they can bring really different individual challenges. So diagnosis, people can go into a bit of shock when they hear the words, "you've got cancer." And sometimes, that shock takes the form of, maybe not hearing the next lot of things that come out of the doctor's mouth, or, it can be hard to process things. Treatment can be a very stressful time trying to, make decisions, and going through side effects that can have a big impact on your lifestyle and can really shake the sense of the self, I suppose, and how one viewed life. Ending treatment, something that Deb was alluding to, or the question that she took was alluding to, is sometimes people can finish treatment and the people around them can be feeling incredibly celebratory or ready to load you back up with a whole lot of, the commitments that you used to fulfill before you were diagnosed. And even though you might go back to looking more normal, there may still be significant side effects ongoing. And sometimes, going through treatment, it can be an incredibly busy time. And so people sometimes don't have the time to sit back and process the emotional side of things. And so the emotions can take time to catch up with people. People can go through treatment and feel like they're coping well. They can get past treatment and they can be months down the line, and then something can happen and something can trigger an emotional reaction, and suddenly they feel a lot of the emotions that I think people might have expected them to feel much earlier on. So it's quite individual how people experience this. And then there is, living with cancer as an ongoing or a chronic disease, and that brings a set of challenges, of its own, a sense of uncertainty about the future. And I think probably we as human beings are not very well set up naturally to deal with living with uncertainty over a long period of time. Humans are really problem-solving creatures in a way. And so we, when we see something that's a problem or we see something that's a danger to us, our instinct is to find a solution to it. And so having something that maybe there isn't really a long-term solution to can be incredibly difficult for people to get their head round, and how to live happy and fulfilling lives with this sort of thing hanging over their heads. So when people are diagnosed, they bring with them a whole lot of individual, history. They might remember friends or family members who have had cancer before, and what's happened to those people in the past may really colour the way people react to a diagnosis themselves, even if it's a very different type of cancer, even if treatment's moved on. But subconsciously and on an emotional level, we're transported back to years ago when something traumatic happened in our family or our circle. All of us have got learned coping mechanisms to deal with problems in everyday life. And sometimes they're positive coping mechanisms and serve us well when we're confronted with a huge emotional challenge like being diagnosed with cancer. And sometimes they don't serve us so well, and we need to, invest time and effort, or people need to invest time and effort to find coping mechanisms that will suit them well. And, just the diagnosis, the treatment and the side effects are often a small part of what comes with cancer. Sometimes things like relationships, finances, and other practical matters can create enormous stress to kind of compound the situation. And different people will have different levels of support from their social networks. Of course, we hope that people will have great support from friends, family, partners, but that's not always the case. And out of all of that comes, the feeling that cancer diagnosis and the emotional response to cancer is a very individual thing. And, there is not a right way or a wrong way to feel. People bring with them sometimes some big preconceptions. I need to cope like this. I need to be positive, or I need, so they've got a lot of ideas about how they should be coping, but everyone is individual and there is not a right or wrong way of coping with cancer. Some of the common emotional reactions, or some of the more common ones, I suppose, shock we talked about, which can make communication, it can make it hard for people to absorb the lots of information that gets thrown at people early on in a diagnosis. anxiety and stress, feeling overwhelmed by all of the information that tends to get piled up on people. Certainly feelings like anger and even guilt. You know, people, you know, it's surprisingly common how often people feel like they themselves, you know, are to blame in some way, on some level, for their diagnosis. And, you know, until I became a cancer nurse, I really didn't realise how many people, in fact, the majority of people, get cancer for no reason that we can establish. Yes, there are risk factors, and we as nurses and doctors spend a lot of time talking about the risk factors because, you know, some of those are things that people can change. But, you know, people get cancer for no reason but bad luck. And many of these people feel like, oh, if I'd done things differently, would I still have it? So that's another difficult challenge that people have. Sadness, loneliness, and I think Deb touched there on the fact that other people can cope, you know, worse with the diagnosis in some ways, or people can, you know, friends, even family members who are very close to people can react in incredibly hurtful ways, and they bring, you know, lots of baggage with them too sometimes to these situations. And so if people are cut off from their normal support mechanisms, it can be a very lonely experience to have cancer. And I think one that I like to focus on a lot when talking about cancer is the loss of control. When people are diagnosed with cancer, a fair amount of their autonomy, their ability to choose their own direction of their life, their, you know, I will do this and I won't do that, gets taken away. And all of a sudden, they're to a certain extent following, you know, orders from doctors and nurses and, you know, turning up to appointments when they might not feel like it and things like that. And a lot of people feel like they don't have much choice about, you know, following these things. So a lot of their sense of control is taken away. And it can be for people that, I suppose, they become very protective of the things that they still do have some control over. And I think that's an important thing for we as healthcare professionals to keep in mind, and for carers as well, that, you know, if you're offering, you know, advice to someone or things like that, it's important that it is offered to people rather than, you know, you don't tell people you should do this or you must do that. You know, if you offer it to people, then they retain a sense of, you know, choice and control over their selves, which all of us, you know, deserve to have. Here we see a little bit of a breakdown or a graphic of just some of the factors really that go into making people feel distressed or feeling overwhelmed. You know, dealing with the unknown must be one of the most common things that I hear on 13, 11, 20 when you ask people about how they're feeling and things like that. Just the unknown, not knowing what comes next, and it's a difficult thing for people to get their head around. Symptoms, body image and self-image is another big thing. If people lose their hair through chemotherapy, or, you know, are used to being a very active person and for a period of time aren't able to be as active, these things can, you know, kind of strike at things that we think are very important to our sense of self, and that's a difficult thing to get your head around. Another thing that I think this graphic just underlies a little bit is the way that a bunch of different factors are linked together. So lack of sleep, lots of different things can play into getting having disrupted sleep patterns. And lots of things flow from having disrupted sleep patterns. So if you're feeling stressed, you're probably less likely to sleep well. If you're not exercising how you'd normally exercise, you might get less tired, less physically tired, and sleep less well. And then if you sleep less well, you're likely to feel more fatigued the next day. And so all of these things kind of chime in with each other and can create a bit of a downward spiral for people. One thing goes wrong and that leads to other things going wrong. But just like that, fixing one thing or making some progress with one element can have an effect of making other things seem better and more bearable. So picking out one thing that seems like a real problem and that you might be able to make a solution to can have a flow-on effect to lots of the other things that are causing someone to be unhappy. Here's a few of the things that people could focus in on. Exercising. So we know that people who are getting a bit of exercise tend to sleep a bit better. It releases lots of positive chemicals and endorphins, and so people who are exercising a bit more tend to report being happier and feeling more positive than people who aren't able to get any exercise. The little graphic that shows people together, reaching out, trying to connect to other people for help and support. There's one that sort of looks like people meditating a little bit, and that probably taps into, you know, having a little bit of alone time, or, you know, meditating, clearing the mind, listening to music and things like that, and getting, you know, good, accurate information and not getting overwhelmed with information. So again, I would say, you know, it's good to focus on one thing, and you don't need to do it all at once. People will come with big expectations. I need to eat perfectly. I need to, you know, exercise a certain amount. You know, the doctors have told me X, Y, and Z. And I'm a big believer in thinking that, you know, setting a small goal and making a small amount of progress in a positive direction is really powerful. So if you're not doing much exercise at all, 5 minutes or 10 minutes, but making sure that you do that 5 or 10 minutes and just building up slowly is a really good way of, you know, tackling the kind of overwhelming feeling of too much to do. I've included a slide about body image and also a slide about sexuality. I think these sort of factors, fertility, sexuality, relationships, and body image, are things that a lot of us as health professionals can feel a bit awkward about raising. And if we as health professionals feel awkward about raising them with patients, often patients will sense that and feel a bit awkward about raising them with us. And that these things, you know, are normal human parts of a, you know, happy and fulfilling life. And if people feel like they can't talk about them and can't look for help for them, you know, that can really add to distress. And for lots of things that are going on with people like this, there are different approaches and there is different support that's available if people know where to ask for, you know, help if those things are issues in your life or in your cancer journey. So when we talk about the sort of supports that are out there to help people with various issues, I mentioned at the start, family, friends, community. We certainly, you know, it's wonderful when people are well supported by those around them and those people are understanding and helpful and supportive. And some people are, you know, blessed with the networks that they've got around them. When those networks aren't there, I suppose that's when we hope that health professionals, such as we nurses and social workers and lots of other things, you know, psychologists can step in to fill that breach and make sure that people without those networks don't miss out. In terms of the kind of community and family and friend support, I thought I'd just mention there's a website called Gather My Crew, which is somewhere that people can go and I suppose if people are keen to help someone who's affected by cancer, it's sort of like a rostering system. So that's something that we sometimes recommend to people. So to move on to the professional support, and I guess, you know, no one goes through cancer treatment relying on only one of these things. Everyone has some combination of all of these different factors, but professional support, nurses, GPs, psychologists and counsellors, it's surprising to me, I think, how many people feel it is a sign of weakness in themselves still to ask for help, or to, especially around emotional things. Maybe this is especially true of, you know, some Australian men, but, you know, a lot of people seem to bring an idea that they should be able to cope themselves with their own resources, and to need to get help from psychologists or counsellors is some kind of a sign of defeat. I think, you know, I really try and stress to people, it's an abnormal thing to be diagnosed with cancer. People are put in an incredibly stressful and incredibly abnormal thing, and it is quite normal for people to need help to navigate that, and lots of people get lots of benefit from that kind of help. Pastoral Care, of course, Lymphoma Australia, and Cancer Council Victoria. I've put the little star next to Cancer Council Victoria because I thought I might just speak about the way the cancer councils in Australia are structured. So there is a Cancer Council Australia. That's a smaller body. It's sort of an umbrella body, and that does a lot of the advocacy work with government and things like that. The state-based cancer councils in each of the states of Victoria are the ones that have lots of programs that they make available for patients and for family members. And each of the different cancer councils has grown up a little bit separately. And so some of the programs we offer in common, but some of them are available in some states, but not yet available in other states. If you call the 13 11 20 Cancer Information and Support line, you'll be connected to a nurse who works in the state that you're calling from. So they'll be able to talk you through what's available in your state. And so we do split, I suppose, in our minds as health professionals into the kind of professional support and also the peer support. Support from volunteers who've maybe previously had cancer or had a loved one with cancer. There are support groups, face-to-face or telephone-based. The Cancer Council runs a program called Cancer Connect, which is a telephone-based program which tries to demographically match people up with someone else who's been through a similar treatment or had a similar cancer experience to yourself. So, you know, if we were, you know, if someone had just recently been diagnosed and they were being offered chemotherapy or something like that, we would try and find from our bank of volunteers, say, another woman about the same age, same diagnosis, who'd been offered the same kind of chemotherapy, and then get that person who's been through it, you know, some years ago, to give the person a call and talk what it was like from their personal point of view. And there's also a Cancer Council online community, which is something that people can sign up to. It's a series of online, you know, chats, forums, blogs and things like that, where people might be able to connect with other people if they can't find a support group that's appropriate for them. So just talking about what we offer, the 13 11 20 information and support line, we're all experienced cancer nurses that work on the line. We're open 9 to 5, Monday to Friday, and we're certainly, you know, able to talk about treatment, about the emotional side of things, but also, you know, if people just need to call up and, you know, talk through things, it's surprising maybe that sometimes you can be very unclear about the way to go forward, but having the opportunity to say things out loud causes things to become clearer. And sometimes people think, I don't want to talk about these things to my loved ones because they're very stressed already. Well, if you talk to a health professional, you're not going to stress the health professional anymore, and it gives you the opportunity to talk out some of the kind of things that might be concerning you. Cancer Council Victoria has got a website where you can get access to lots of our information, read about the different programs that are available. You can get PDF copies of our booklets and fact sheets, and there's one on emotions and cancer. There's a fact sheet about learning to relax, but lots of those other things that contribute to emotional distress, like finances, cancer pain, sexuality, and things like that. There are publications that talk a bit about it and also provide lists of other places that people can get support. We also mail out copies of relaxation and mindful meditation CDs if people are interested in them. Just touching on a few other elements of personal self-care, learning to say no, learning to ask for help. And if people have been helpers and carers themselves, quite often, you know, mothers or parents learn to be kind of quite self-sacrificing, and learning to ask for help can be a challenge in itself. Setting boundaries, prioritising is a good one. You know, quite often if people have got lots of things that they're concerned about, they get halfway through thinking of one thing, and then all of a sudden they start thinking, well, I can't do this because of this other problem. And suddenly they're thinking of a whole chain of different problems, and it means that they can't really solve any of them. So working out, you know, a list of the problems and then just focusing on only thinking about one at a time is an important skill to learn, and being kind to yourself. Some kind of other supports that are out there, Beyond Blue, Lifeline, and the Suicide Prevention Line. Again, I think there's maybe a bit of a perception in the community that some of these supports are only for people who have got serious mental illness. And, you know, I try and stress to people, no, these are for all of us. You know, every one of us, if we come into abnormally stressful situations and we feel like we're not coping, these services there, and Lifeline and Suicide Prevention Line, are, you know, 24-hour a day, 7-day-a-week services. And if you just need a human voice to speak to, that's why they're there. And just to touch on a few final thoughts before I wind up, you know, reiterating that idea around the loss of control, and making sure that, you know, people do get to retain control when it's possible for them to have it, and choose their own path with their own health. The writing of a list of what's worrying you and focusing on one point at a time. Saying what you think out loud can help clarify your feelings. Achieving small goals is better than missing a big goal. So I hear so often people going through treatment and they're saying, you know, that they've been trying to do all this exercise or different things like that, and they haven't been getting there, and they kind of feel defeated. No. If you don't get a goal, set it a bit lower. Set it a bit lower until you get, you know, you're setting yourself a goal that you can get, and then gradually build up from there. Seek help if you feel you need it. And probably the final thing is, you know, with a lot of the supports that are out there, it is not a one size fits all. So there are lots of different counsellors and lots of different psychologists, and they come from a lot of different backgrounds and approaches. And if the first person you speak to doesn't seem to be speaking your language, it is worthwhile going back and getting a re-referral and trying to find someone who does speak your language, because you'll get much more benefit from it that way. So that's all that I've got to say, but I'd be happy to take any questions if there are any, and I hope that has been interesting to you and gives you a little bit of insight into some of the the things that we talk to people about and the things that we refer people on to.
Excellent. Thank you. Thank you so much, Clem. That was a really good overview and some very important points that you made there. And also, I think it's really good to help normalise that a lot of people go through a similar situation and similar emotions, and there's no right or wrong time as well along the journey that people have these